Hello, my name is Lena Parker. I am a Doctor of Physical Therapy student at Regis University, and today I'll be presenting on rock climbing specific finger strength in two types of hand grips. I'd like to thank the Rocky Mountain American Society of Biomechanics for accepting this presentation. I'd like to thank my research advisors, Kevin Cowell and Erica Nelson-Wong, and I'd also like to thank the rest of the research team, Emily Higgins, Jonathan Crawley, Stephanie Huang, Claire Larbecki, and Sean Wood. In recent years, technical rock climbing has become an increasingly popular sport. Rock climbing places unique demands on the finger flexors, tendons, and annular ligaments of the hands. Climbers must adapt their shoulder, hand, and finger position according to the features of the terrain they are ascending, and occasionally must make decisions about which grip is optimal to use. The two most common grip types are open hand, used for broad holds or holds with a smaller ledge, and a crimp, which is used for smaller holds with a deeper ledge. Previous climbing studies have utilized handheld dynamometry to quantify grip strength in this athlete population, but handheld dynamometry strength does not translate well into strength on the climbing wall due to lack of specificity in arm and hand position. Therefore, we have utilized a rig that puts the subject in a more climbing-specific position in order to obtain upper extremity strength values that will be meaningful to climbers, coaches, and clinicians. The purpose of this study is to observe if there is a difference in strength between an open hand grip and a half crimp grip during a maximal isometric pull. While this research is in its preliminary stages of data collection, we hypothesize that there will be no difference in force between the two grip types. We had 15 participants in this study. Self-reported information such as health and climbing experience were collected prior to starting the testing protocol. Climbing skill and anthropometric measurements such as height, weight, and arm length were performed on all participants. After a standardized warm-up, participants completed a maximum pull testing protocol with a test rig consisting of a wood climbing hold with a 20mm lip attached to a load cell. Participants were asked to perform maximum isometric pulls with the two grip types, an open grip and a half crimp. Participants were instructed to gradually ramp up to their maximal isometric pull, which was then held between 3 to 5 seconds. The shoulder position was held at 90 degrees of flexion. The testing protocol was randomized with 2-minute rest intervals between each pull. A total of 8 trials, 4 for each hand grip, and 2 trials per side, were performed. Peak force measures for each trial were normalized to the participant's body weight and entered into paired t-tests to explore potential differences between the two hand positions. This is a photo of the two different hand positions we tested, with open hand on the left and half crimp on the right. The open grip is defined as the second through fourth digits of the distal interphalangeal joints, or DIPs, and proximal interphalangeal joints, or PIPs, greater than 90 degrees. The half crimp is where the PIP joint of 4 fingers was positioned at 90 degrees. Our results are expressed as a percentage of the participant's body weight. Based on this data, we reject our original hypothesis and conclude that there are differences in strength between open hand and half crimp positions on both the right and left hands. Participants were able to pull harder with their hand in a half crimp compared to an open hand position. This can be due to a number of reasons, including experience level with these types of holds and recruitment patterns of forearm musculature. This quantitative data does not take into consideration hand dominance, as we only had 1 participant so far that was left dominant. We predict that these findings will strengthen as we collect more data from a broad range of experience levels. The methodology used in this study closely mimics climbing-specific grips, and therefore can help guide clinicians or strength coaches working with rock climbers. It can be implemented into a protocol as a baseline measure of finger flexor strength or used as a measure of change, showing the effectiveness of intervention in both a rehabilitative and strength training setting. A2 and A4 tendon pulley injuries occur in 25% of elite climbers according to Chang et al. The half crimp position places more stress on the A2 tendon pulley, the DIP joints and their volar plates, and the flexor digitorum superficialis tendon insertions on the middle phalanges. The open hand places more stress on the A4 tendon pulley. Therefore, if you have a climber who has an A4 injury, it may be beneficial to perform climbing-specific strength testing in an open hand position. Both open hand and half crimp hand positions are necessary to succeed in a variety of climbs. Coaches and clinicians may consider training open hand more than half crimp to develop a well-balanced climber. This area of research can open up to a number of other research questions. As we collect more data, we can observe the relationship between these two types of grip in anthropometric data, participant demographics, climbing experience, arm position, and rate of force development. Our goal is to have 50 participants for this study. We are still undergoing data collection. If you live in the Denver or Boulder area and are interested in being a participant, reach out. You must climb at least once a week, have no current upper extremity injury, and be between the ages of 19 to 50. We would love to have you. I would like to thank the Climb Clinic and G1 Climbing and Fitness in Broomfield, Colorado, for providing the space and expertise to perform this study. Thank you for watching my presentation, and I'm looking forward to further discussion in this area.